I'm Logan Crawford, and right now on GBM, we're sitting down with Dr. James M. Brasfield to discuss the Affordable Care Act at the nexus of politics and policy. It is a clear-eyed deep dive into how what is commonly called Obamacare was built, battled, and ultimately sustained. This book cuts through the noise to unpack the real political dynamics, the legislative chess moves, and the policy trade-offs that shaped the ACA from its origins through implementation and beyond. If you're into U.S. politics, health policy, or how major laws survive relentless pressure, this book, this conversation is for you. We're delighted to have this very talented author join us here today. We thank the team at Atticus Publishing for helping us put him on TV today. And we ask viewers like you to support authors like him by subscribing to our channel and by purchasing his amazing book. The links are below this interview. Jim, thank you so much for joining me here today.
Yeah, happy to be here today.
Happy to have you on the show. This is such an important book because I think there's a lot of misunderstandings about Obamacare. It's not just for poor people, it's for working people who don't necessarily have health insurance because a lot of people are per diem, contract employees today, freelance, and so forth, or entrepreneurs, and they don't have traditional health insurance. Obamacare has come to the rescue for those people, don't you think?
Yes, and we can't forget about the people under Medicaid as well, because about half of the people covered under the umbrella of what the Affordable Care Act has done are covered under the Medicaid expansion. And there's still 10 states that have not expanded Medicaid, but in my state of Missouri, which the voters voted to expand Medicaid a couple of years ago, a significant number of new people who were previously uninsured are now being covered under Medicaid as well. So sometimes that's forgotten but that was of the two main components to try to reduce the the number of uninsured. The Medicaid expansion was one because Medicaid was tied to the welfare system, and so people, particularly men who were not part of the welfare system, weren't able to get coverage of Medicaid even if they had very low income. So between the two, between the marketplace and Medicaid, ACA has been very successful in reducing the number of uninsured to about by half. Uh, from when it was first adopted to last year.
Yeah, it's a great portal. It's a great gateway, like you said, to either health insurance, uh, the health insurance marketplace, or a way to get onto Medicaid if you need it, if that's what your income is. Talk to us about the book. What's the basic theme, and why did you decide to write it?
Well, I wrote another general health policy book in 2010, and after about 5 years, I decided maybe it was time to do something else, and the ACA was just getting started then, and I thought that doing a book about the ACA and it's 5 years, after 5 or 6 years would be a good project to pursue. Well, then Trump was elected, and 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 suddenly it looked like there wasn't going to be any ACA shortly. And I had a conversation with the publisher, and we decided that maybe I'd just kind of do an obituary of the ACA because it looked like it was going to end in 2017. Well, then 2017 and 2018 came and went, and there was still Obamacare was still alive and well. And so I had another conversation with the publisher, and she agreed to that I should do it as kind of a 10-year, and that I would turn in a manuscript in 2021, which would take into account the 2020 election. So that's how the ACA kind of in between I kind of paused to see what was going to happen, and then the book finally emerged. And the basic theme of the book, I think, is, as the title implies, a nexus of politics and policy. There's a lot of academic and other work out there kind of getting into getting into the nitty-gritty detail of coverage and cost and so on. And then there's some things out there covering the media coverage and some academic coverage covering the politics of surrounding it. But I thought that there wasn't much out there that combined those two things, that looked at the academic think tank literature as well as looking at the politics of how these things came to be and some of the policy trade-offs. So that's the kind of core of the book, is to look at the ACA 10 years after its enactment and try to assess, has it been successful, unsuccessful, and how the politics and the policy played off against each other to create the reality of the ACA, which in my view, and I think the view of many others, is the most significant healthcare legislation that has passed in the United States since the passage of Medicare and Medicaid in 1965.
Absolutely. And fortunately, Trump is enough of a pragmatist not to have messed with it too much. Because I think, as we described earlier, in this work environment today, it's needed. Because people getting that 9 to 5, staying with a company, building that career over 30 years is kind of gone with the wind, right?
And
People are,
no, that's correct. The latest information from Kaiser is that a standard family health insurance policy costs about $25,000 a year in premium.
wow,
And for somebody whose employer picks up part of that, and usually the employer will pick up somewhere in the neighborhood of 70-80% of the cost of that. That makes health insurance more affordable. But if you're working for 60, $80,000 a year, fairly healthy income and so on, and have to pay $25,000 a year for health insurance, there's not much left to pay the mortgage or to pay the grocery bills each week. So for those individuals, it's been a godsend to provide healthcare coverage and some other provisions, like young people can stay on their
yeah,
their family's coverage till 26, and and also important provisions such as eliminating pre-existing conditions. So,
mhm,
it used to be that if you were trying to get health insurance and you had some kind of condition, that might preclude you. The insurance company would say, well, we're not going to insure you because you had cancer 5 years ago and it was successfully treated, but you have a pre-existing condition. And so there are a number of things that the ACA has done to make private health insurance, more viable
mm.
for millions of Americans.
Don't you think it'd be political suicide to try to get rid of the ACA at this point because so many Americans are vested into it?
I would think so,
Yeah.
but there's still some Republicans and some conservative think tanks and so on who criticize the ACA. I mean, sometimes they make legitimate points in terms
Mhm.
of some weaknesses or flaws in the ACA, but certainly, right now, the debate over the extended tax credits, which the early in the Biden administration, tax credits were extended so that more people making above 400% of poverty, and people at the very low end of the spectrum would have to pay less, and both of them would have to pay less money. And those extended tax credits have helped increase the enrollment in ACA plans significantly. But unfortunately, when they were adopted in 2021, the Congress put a expiration date on it of January 2026, and I suppose part of it was they thought we're still going to be in power and we'll just
Mm.
extend it when it gets to that time. But now the Republican majority in Congress has been unwilling to extend it, and that was the main cause of the shutdown that took place a couple of months ago, and still seems to be an issue that many Republicans in competitive districts are worried about because many Americans respond to pollsters saying healthcare and the cost of healthcare is my biggest concern. And for people out there who lost their ACA coverage because they can't afford it anymore because the extended tax credits are going down have gone away. I would think for many Republicans that would be a difficult situation, but maybe for a Republican who's in a very safe district and
Mhm.
thinks, well, if some people don't vote for me, I can absorb that. So I think it's going to continue to be a debated issue over the next few years.
Yeah. What I like best about the ACA or the Obamacare, whatever you want to call it, is the fact that it didn't blow up the current healthcare system. It basically just made it a way for people to access healthcare as opposed to socialized medicine or something like that. Talk to us a little bit about the compromises
Yes.
that went into making this a law and why lawmakers chose not to do like a Medicare for all, for
Yeah.
example.
Well, as I noted in the first chapter of the book, which is kind of a history of the last 100 years of trying to reform and change healthcare, that when Medicare was enacted in 1965, many of the Medicare proponents saw that as being the first step towards what we would call today Medicare for all, basically
Mhm.
expanding the traditional Medicare system to include the entire population. And that was a goal particularly among Democrats for 20, 30, 20, 30 years, and they were never able to achieve it. And then in the early aughts in Massachusetts, a conservative Republican governor, Mitt Romney,
Mhm.
and a liberal Democratic House and Senate in Massachusetts came together in a compromise and created a system in Massachusetts that was based on expanding Medicaid and having electronic marketplace where people could buy with some subsidy could buy private health insurance. So a kind of expanding Medicaid rather than Medicare and creating a better system for people that were outside the work-based system. And we knew from polling at the time and over the years that it has flaws, but that most people were fairly satisfied if they had work-based insurance. And so upending that would be difficult. And that Massachusetts plan, appeared after a couple of years to be pretty successful. And so all the various factions within the Democratic Party kind of coalesced around that in the 2008 campaign, and ultimately Obama as well as Hillary Clinton and others said this is what we should do. So when Obama had a majority in the House and the Senate, and they proceeded to develop a plan, and I don't want to get too much into the weeds, but there were a
Mhm.
lot of kind of minor issues in general, but big issues to some people, like abortion. I mean, are we going to cover abortion in the marketplace plans? And a lot of Democrats thought, yes, that was a critical issue, and we should do that. And another set of Democrats were more conservative and said, no, we shouldn't do that. And so finally, they reached a compromise. Nancy Pelosi, talked to various factions, and they reached a compromise on that. And so there were a number of issues, but one of the things that I think hurt in the long run going forward was that the House had a more liberal set of benefits than the Senate did. And had the Democrats not lost the Senate seat in Massachusetts and therefore gave them 59 instead of 60 votes, the House version, something closer to the House version in terms of benefits, might have been there. But because of that loss, they were forced to go with the Senate version and the House buying into the Senate version. And so the 400% of poverty limit, that you get nothing
Mhm.
above that, means that there are a whole set of people who would have trouble paying 20 or $25,000 a year for, and those are the people that you mentioned, working independently or working for
Mhm.
a small business or entrepreneurs. And so those were the folks that were kind of neglected in it. And when the Biden administration, coming out of COVID, wanted to increase the subsidies, they included that. And so the system was that if you had eight and a half, if you had to spend more than 8.5% of your income for health insurance, then we would cover you, and you would get some of the premium paid for. And
Mhm.
that helped a lot of those folks who were just a little bit above the 400% of poverty limit. And but that has gone away. And so those folks are getting a lot of, I mean, they're the ones that are particularly angry about the loss of the subsidy. So
Yeah.
what I tried to do in the book was to look at the substantive issues involved in both in the original creation and then how it played out over the 10 years after enactment, as well as try to give the reader a handle on what the politics were like, and the politics, to some extent within the Republican Party as well as within the Democratic Party, because when it came time to trying to repeal, it was some Republican senators like Senator McCain and Senator Collins who didn't provide the votes that otherwise there may have been a major repeal of the ACA in 2017. But the Republicans were also divided about, okay, if we repeal Obamacare, how are we going to replace it?
Right.
And they talked about having a wonderful replacement, but they could never agree on what that wonderful replacement might be.
Exactly. Yeah. And they've been talking about, we're going to give you something better. Well, tell me what that something better is so I can compare and contrast. Because right now, there has been no concrete proposals that I've seen put out there in any realistic fashion that address the needs that Obamacare addresses.
Well, and I mean, what that's been part of the problem for the Republicans who have opposed it, and they have proposed expanding, what I and others would call junk insurance, which
Right.
is very cheap insurance. And I remember I was on a radio talk show just soon after the enactment of Obamacare, and somebody called in and they said that they were going to have to pay a lot more for insurance now because they were currently getting health insurance for the whole family for $100 a month. And I thought I didn't want to make a snarky comment, but
Right, exactly.
I thought that they probably didn't have very good insurance,
Yeah, you
and and
basically get
and
what you pay for.
that's
That's what
that's
it comes
right,
down
and
to.
you're not going to get coverage. It's not going to cover pre-existing conditions, and if you have to go to the hospital, suddenly you may discover. So the expansion of that kind of junk insurance, and we know that half the people in the country in any given year have a relatively low healthcare expenditure.
Right.
They don't have cancer, they don't go to the hospital, they don't, maybe they go to the doctor once or twice a year, and that's kind of it. And we know about half the people in the country in a given year are like that.
Yeah,
And we know that uh, the premiums that those folks pay for the high costs that 5, 10, 15% of the population. And that's kind of the way health insurance works. And
exactly. If we
and
knew
yet
when we were going to be sick, we'd buy it right before we got sick, but we don't
Well,
know
and
that.
that's what the insurance companies were afraid of, and that's why
Right,
they put in that's why the individual mandate was part of it, to keep
right.
people from
Only
doing that.
accessing when they were sick. Yeah,
I remember
absolutely.
when in teaching my health policy course and in talking about health insurance at the beginning, and I would frequently say, if somebody has fire insurance and they pay X amount of dollars a year, and at the end of the year, if their house hasn't burned down, they don't say, gee, I wasted that money. My house didn't burn down. But
Exactly.
oftentimes people at the end of the year, if it seems like they haven't spent as much in healthcare as they paid in the premiums, that they think, oh, gee, I was gypped. I should have had a cheaper premium. But the
Get one
principle
thing
of in,
wrong with you. Get one thing wrong with you, and if you're in the hospital 12 hours, I guarantee you your bill will be $100,000
oh,
if you're in
yeah,
the greater
no.
New York City
And
area.
I think many people don't realize that, and that's part of the reason that the appeal of, oh, gee, let's get rid of Obamacare and let people just buy cheap insurance. There's a certain segment of politicians and others that appeals to, but if you look at the reality of health insurance and healthcare costs, you know that's not going to work, and we have to pay for it some way, and the system that we move towards with Medicare and the ACA is that through our taxes, we pay some through premiums of one kind and another,
Mhm.
and even in Medicare, I have
Right.
Medicare, but I pay a premium and so on. But the other part of it is we all are paying in as part of our taxes, and
Yep. It's a
and
fascinating look. It's a fascinating book. The name of the book is The Affordable Care Act at the Nexus of Politics and Policy. It is a
oh, there,
clear-eyed,
there
deep
we go.
dive into how Obamacare was built, battled, and ultimately sustained. Jim, thank you so much for joining us here today.
Okay, thank you for having me. I've enjoyed the conversation.
I enjoyed our conversation as well. I appreciate your insight, your candor, and your wisdom when it comes down to this matter and this important policy and law for the people of America. To the folks at home, I'm Logan Crawford, thanking you for your time this time. Until next time on the Global Book Network.